Hi, I'm Maria. I'm going to be your student nurse today. I'm just going to wash my hands real quick. And I just need you to verify your name and date of birth for me.
Jennifer Waldner, 6/17/84.
All right, I'm going to check your wristband, and I have my doctor's order somewhere. Where did it go? I'm going to match that on my doctor's orders. Yep, and it matches. And do you have any allergies today?
No.
All right. And I have doctor's orders today. We're going to give you through IV medicine. It is ceftriaxone, and it's 1 gram. It's 1 gram IV every 24 hours for pneumonia. I'm just putting my gloves on here. And then I'm just going to compare it with my MAR. Okay, and I have my ceftriaxone, rosifene, 1 gram IV every 24 hours for pneumonia. It's also here on my MAR for the IV ceftriaxone, 1 gram IV every 24 hours for pneumonia. Okay, so that's good. So now I have my MAR. Just going to keep that right here. Okay. I'm just going to check here for phlebitis and also for infiltration at the site. And it's not cold to the touch. There's no signs of infiltration. I can see that it's going through the veins. No redness. Is there any pain or tenderness here for you?
No.
No? Okay. And there's no redness or tenderness, so there's no signs of phlebitis. So I am going to go ahead and tell you about ceftriaxone. For the adult dose, it's 1 to 2 grams, and we are doing 1 gram on the order, so we're within the parameters. And compatibility, it is compatible with the saline solution, so we don't have to worry about that with the primary bag that we have. It's contraindicated in previous hypersensitivity reaction to cephalosporins, hyperlipidemic neonates. It's used for treatment of serious lower respiratory tract, urinary tract, skin structure, bone and joint, and intra-abdominal. And he has pneumonia, so that goes for the respiratory tract, so we are using the right medication. As far as action, it's a broad-spectrum, 3rd-generation cephalosporin antibiotic, bacterial, just selected gram-positive and anaerobic organisms, effective against many otherwise resistant organisms, inhibits the bacterial cell with sepsis, therapeutic concentrations achieved in many body fluids and tissues, including CSF, high protein bound. So we don't have to worry about sulfa because it doesn't contraindicate with that. As far as we want to watch for early symptoms of hypersensitivity reaction. Monitor PT and administer vitamin K as indicated, and monitor CBC for development. And patient education, you want to report promptly any bleeding or bruising, symptoms of allergy, difficulty, breathing, hives, itching, or rash. Promptly report diarrhea or bloody stools that occur during treatment or up to several months after antibiotic has been discontinued and may indicate CD/AD and require treatment. Drug lab interactions, the risk of nephrotoxicity may be increased with aminoglycosides and other nephrotoxic agents. Probenecide does not increase blood levels as it does with other cephalosporins, may be antagonized by bacterial antibiotics. Large amounts of cephalosporins and salicylates may induce hypothrombonemia. The addition of agents that affect platelet aggregation and or may have GI ulcerative potential. Can also do false positive Combs test. Side effects, full scope of hypersensitivity reactions, including anaphylaxis with fatal outcome has been reported. Allergic pneumonitis, biliary sludge, CD/AD, other hematologic reactions, diarrhea, hepatic dysfunction, and lots of others. So antidote, notify a physician of any side effects, discontinue the drug if indicated. So CD/AD, hypersensitive reaction, seizures, SS, gallbladder disease, and stuff like that. All right, so done with that. Now I'm just going to take a look here at my packaging. It is intact. It has not expired, and this is for my tubing. And now I'm going to do my first check here. All right, so I have my 50 milliliters partial fill of the cetrafloxone, 1 gram IV every 24 hours. It's not expired, package intact, no crystallization. Then I got my 50 milliliters here, 0.9% sodium chloride, plus cetrafloxone, 1 gram IV every 24 hours. Okay, and I already did my math here, and I have 75 milliliters an hour, and that's 12.5 drops a minute. So about 3 drops every 15 seconds. Okay, I do the check here. I got my 50 milliliters partial fill here, 0.9% sodium chloride. It is not expired, packaged intact, and that is compared to my MAR. And then I got my 5 rights. I got my right patient, right medication, right route, right time, and right dosage. And then do my last third check here. I got my 50 milliliters partial fill, 0.9% sodium chloride, and that's compared onto my MAR here. We're doing 1 gram IV every 24 hours for the most. Okay, so I have my 3 checks done. So now I'm going to open up my tubing here. Set that here. Okay, and I want to get my bag lowered. I'm just going to take this, my primary bag lowered. Take this down. There we go. Alright, so that is lowered. And I also want to prime or close my tubing off here. Clamp, make sure it's clamped. Alright, so that is closed. So now I want to get my medication bag ready. I'm going to open that up. Okay, and there's 2 caps, and I don't want to use the blue cap. I want to use the actual yellow cap. Okay. Oh yeah, well, not yet. But I do need alcohol. Yeah. I can't get the yellow cap off. Hold on 1 second. Okay. Get my yellow cap off. Yes. Press my call light and get someone to open up my yellow cap for me. Well, in this case, it's a blue cap, so 1 second.
I did. Check the letters on the page. Right now.
Just trying to get it open. There we go. All right, I'm going to take my needle. Make sure that I'm going thumb to thumb.
Get rid of, yep. And then you gotta get your 10 factors of your
All right, so I got that in. All right, so I'm just gonna hang this real quick up high. And I'm going to take this top port and I'm going to clean that off for 30 seconds with an alcohol swab. Vigorously, 30 seconds. Okay, it's been 30 seconds. I'm going to take off my cap here. And thumb to thumb, and push and twist. All right. So now I want to prime my tubing. So I'm going to take my medication bag and lower it. And release that slightly so I can prime my tubing. And I can see the fluid going in from the primary bag. It goes quite quickly. And I'll fill it up about halfway. Okay, and it's about halfway. All right, so we're good there. I have no bubbles. All right, so we are connected, and now what I'm going to do is you actually monitor the drop rate through the primary release. So I'm going to release that slowly, and I'm going to get my 3 drops for 15 seconds.
And then you're gonna have, okay, so, well, 75 and now, 1 hour, you gotta get rid of the hour, so 1 hour, 16 minutes. So, 9, 10, over 1.
Let's have another one.
Then 12.5, get rid of the hour, you get rid of the amount, you do that. With 12.5, you want us to round to 12.
All right. And I got my 3 drops per 15 seconds, so we are good there. All right. So that part is done. As far as removing the catheter site, I would want to put this pad underneath the arm, wash my hands, put on non-sterile gloves, remove the old dressing that's on top of the catheter site or IV site. And then I'm going to take a new piece of gauze and place it on the side, not putting any pressure, and then pull the catheter site out straight. And then apply pressure down onto the site for 1 to 3 minutes. But during labs, we would do 2 minutes. And then once I remove that, then I would put fresh, clean 2x2 gauze on there and tape down. Then I would also tape down the time and date onto the tubing from the medication. And it would be complete. Is there anything else I can do for you today? I do have time, and I would document.